Hi, I'm Dr. Patrice Harris, a psychiatrist and Everyday Health's Chief Health and Medical Editor. I'm joined today by Dr. Tamika Cross, an OB-GYN in Pearland, Texas. We've selected Dr. Cross as one of the health change makers for our Black Health Facts MLK Day and Black History Month feature for her work providing affordable, accessible care to underserved communities and to women of color, where I think we all know culturally competent care is not always available. So I'll hand it over to Dr. Cross to further introduce herself.
Thank you, Dr. Harris, for the warm introduction. Yes, my name is Dr. Tamika Cross, and I am a board-certified obstetrician and gynecologist practicing in the greater Houston area, specifically in a suburb called Pearland. Pearland is about 15 miles south of Houston. It's a pretty diverse area of Houston that has pretty much every different type of ethnicity. I also have a practice there, Serenity Women's Health and Med Spa, that we opened not too long ago in the middle of the pandemic. And so we're able to provide that affordable, compassionate healthcare to women in the area.
Well, I definitely want to hear more of that amazing story, opening up in a pandemic. But first, tell me a little bit more about you. Did you grow up in a diverse community, or was your experience similar to mine? I was born and raised in West Virginia. And although my particular community was diverse, certainly communities of color made up a small proportion of the community. So tell me a little bit about you and where you grew up.
Yeah, absolutely. So I'm originally from Detroit, Michigan. And so Detroit is definitely a predominantly Black city, African-American city. However, we did move out to the outskirts, to the suburbs when I was in elementary school. And so it was more diverse at that time in the early 90s. But over time, it has become an area of more minorities. So I would say for most of my education and most of my years growing up, I was in an area where I was around more minorities, where I wasn't really the minority.
And was your experiencing growing up a part of what led you to first, of course, become a physician, but then to specialize in obstetrics and gynecology? And if not, what inspired you?
Yes, absolutely. So although it was a diverse area that I grew up in initially when I was younger, and then it became predominantly African-American, what I didn't see a lot of was African-American physicians. I did have an African-American pediatrician and dentist growing up. And so in my younger years. And so that was very, warming, especially to a young aspiring physician. But it did definitely lead me to want to be the change I wanted to see, essentially, especially coming from a city where I saw many Black professionals, but not necessarily as many in the healthcare field.
That was a little bit different than mine. I did not meet a woman African-American physician to after my undergraduate years. So it sounds like you had a mix of some African-American professionals, but not as many in the medical field. So tell me how long you've been practicing and how has your practice evolved since leaving residency?
Yeah, so I've been practicing independently for going on 5 years out of residency. And it's definitely evolved quite a bit because I was in academics originally, where I was working in the same academic program where I did my residency at the University of Texas. And then I moved over to private practice. And so that was definitely a different experience. And so what I was able to see at that time was going from working in the county hospital. We actually had privileges at multiple hospitals. So I was able to work at the county hospital with uninsured patients. I'm here in Houston, Texas. So we have a lot of patients that, are immigrants as well. And so I was able to take care of those patients that needed care and hadn't seen doctors in years, but then also able to take care of patients in other facilities where they may have more access to care. So kind of getting exposure to both sides, I think kind of really helped to build me up as a physician to be a little bit more well-rounded in that approach.
I think we share that experience. A lot of folks share that experience in residency, where we certainly are able to take care of patients who may have more access, may have insurance, but also we take care of patients who are either uninsured or underinsured. And I always talk about the privilege of being a physician and the fact that we have front row seats to what's working in healthcare, but also what's not working. And clearly the health inequities and issues surrounding the health inequities are not working. And we've had the privilege of seeing both sides, and certainly there are many sides in between, if you will. So you were lauded early on in your career, receiving the United States Congressional Recognition for Community Outreach and being nominated as one of Becker's Hospital Review's top 60 most powerful people in healthcare in 2016. I remember that because I interviewed you then. Can you share the work you did to receive that recognition? I know about it, but the world needs to know about it.
Yeah, I did a lot of different things at that time. I was actually still in residency, finishing up my residency at that time in OB-GYN. And some of what I was doing was working with like surgical site infection task force and trying to reduce infections and things like that in the county hospital system. Also working for different task forces with the hospitals to be able to reduce maternal mortality rates as well. In addition to, I was in the news for, an incident that happened on a plane where I wasn't allowed to, render aid to an unresponsive passenger, and because they didn't think that I fit the description of what they thought a doctor looked like. And so from that, I used that situation that we've all probably faced at some point in our career to really not let it die down and continue to talk about it and start a national, well, really international conversation at that time about bias in healthcare, and continued going coast to coast talking about bias in medicine and in the workplace, and how we can, what we can do to overcome our own bias and how it affects patient care. So that was some of the things that I was doing back then, and still to this day.
Absolutely. And I want to personally thank you for that work. And when I interviewed you back in 2016, we were talking about that because it is easy to forget after a particular incident, the stimulus for an incident. And I just applaud you for continuing to elevate these issues around bias. And I also appreciate and applaud your passion to reduce maternal morbidity and mortality, especially among Black women who we know die 3 to 4 times more and have birth complications 3 to 4 times more than white women. And that is even when you account for those who have privilege, who have health insurance, who have had access to prenatal care. So again, applaud you for highlighting that and your work, because that's so important. So can you hone in on that a little bit more and tell us about the work you've done to help to reduce maternal mortality and morbidity?
Absolutely. So I think the first thing is just starting the conversation and talking about it and recognizing that bias exists in all of us. And when it does exist, really understanding the impact that it can have on how we treat our patients. And so realizing the different barriers and the systemic issues that are impacting our African-American women that are leading to this alarming statistic. And so really, since it's more of a systemic issue, it's really trying to change some of those things. And so I think the biggest thing is by having more of us, people of color, specifically Black women, in those leadership positions, sitting on those task force, sitting on those different panels that are making decisions at the hospital. And also by, I think, reaching back to our youth it's important to get more kids involved in pipeline programs to be able to get them to go into these medical fields, because at the end of the day, that's what makes a difference as well. Because there's even studies that came out in the past couple of years as well that has shown that patients that are cared for by African American physicians actually fare better. And it's because it's eliminating some of that racial bias that we know occurs. And so, which is one of the major factors when it comes to the maternal morbidity and mortality crisis that's occurring here in America. So I think that those are a few of the things that I've definitely tried to talk about and just really make everyone aware that these issues exist, because some people are blind to it. And by identifying that these issues exist, moving forward to how do we fix these issues? And, it's not something that changes overnight. So really kind of coming up with different strategies and plans to really get to the root of the issue.
And you mentioned systemic issues, and I think that's critically important to amplify. Yes, individual biases certainly must be reviewed and looked at and overcome, but we also need to look at the larger systems when we are talking about these unacceptable health inequities when it comes to maternal mortality and morbidity. Dr. Cross, we are seeing several states pass legislation that not only restricts a woman's ability to have available to her all of the options, specifically options regarding pregnancy, termination, and abortion, but also in some cases criminalizes physicians for offering care, evidence-based care that is legal. Can you say a little bit about that? I know, of course, you live in Texas and we've seen the laws in Texas. Can you say a little bit about the impact to women who are marginalized and minoritized and frankly have less resources?
Yeah, absolutely. It definitely impacts women with less resources at a disproportionate rate, because by essentially banning abortion, they're not calling it that, but essentially that's what it is. Because by the time they come to the doctor, there's already, going to be a heartbeat at that point. And so by creating those laws and limiting that ability to be able to make that decision for themselves and for their pregnancy, now, women without resources don't have the ability to travel to another state to be able to have the procedure performed like women of, a multitude of resources. So it definitely disproportionately affects women of color and women from a lower socioeconomic status. And so I think it's atrocious. I think it's horrible. And then criminalizing physicians for providing the care that, we train to be able to provide for patients, where we can't even, recommend that they go to a certain clinic. We can't even make that recommendation or assist in any kind of way, or else, you could be, fined. And then they also incentivize people for reporting physicians or reporting, transportation or anything like that to actually assist these women in getting the termination procedures performed. So I think it's horrible, and I think the climate that this has created is horrible, because now what you're seeing as a result, and what we're going to continue seeing, is women making, out of desperation, making choices to, have procedures performed by, people who are not physicians, or from clinics that are not, true, healthcare clinics that, back alley procedures, as if you will. And, that's going to, increase the septic abortions and all these different, complications that could result and affect their future fertility when they are ready to have children. So it's a big deal. It's a big deal here in Texas.
Well, thank you for weighing in on that. Certainly impacts all women, but we do need to make sure that we are looking at these issues through an equity lens, and the disproportionate impact that you noted needs to be elevated and amplified and discussed. So thank you. Well, you've also written 2 books, and I need to learn your secret because I haven't been able to write one book, although I keep saying that I am. But you've written 2 books, Overcoming Challenges and What a Doctor Looks Like. And certainly your experience that you outlined earlier sparked that What a Doctor Looks Like hashtag and that movement. And that was such a powerful experience. And I remember learning about that and reading about that, and again, interviewing you back in 2016. But I believe that led you to this powerful quote that I've always loved. I am young, Black, and female, and I am exactly what a doctor looks like. Tell me more about that again, and how do you think we've evolved, if we have, from 2016 until now?
Yeah, so about that quote. So kind of going back to bias and stereotypes a little bit, I think, in prototypes. So when someone says, the doctor's coming in, I think a lot of patients have made up in their mind, what they expect that doctor to look like. And a lot of times, it's not me, it's not you. Right. And so at the end of the day, it was just saying that, regardless of age, regardless of gender, regardless of ethnicity, regardless of sexual orientation, what have you, religion, like we come in all different shapes and sizes, and there is no prototype of what a doctor looks like. And, if I come and introduce myself as Dr. Cross, and that's exactly what I am. And so that's kind of what sparked that quote. And as far as us evolving since that time, I do think we have made some strides in the right direction since that time. I definitely do. I've seen the conversation continue. I've seen lots of different programs come about within different companies, not even just airlines, different diversity trainings. I've seen like all across the board, different industries as well. And so I do think people are more aware of it, and people are speaking up about it. So it's one of those things that a lot of times used to happen, because that wasn't my first time having that type of discrimination. And a lot of times we kind of shrug it off and we become, somewhat, desensitized to it and move on. You saw, I think Time Magazine created an article where they highlighted like 20 different doctors that are healthcare professionals that had similar experiences. And so it just more people started coming out of other similar experiences. And so I think that's kind of what it gave light to, is to be able to talk about it, to be able to change, to be able to try to fix the issue. So I do think we've made strides in the right direction, but I think we still have quite a ways to go.
I so agree. Progress is sometimes slow. I will admit that I have become a little bit impatient as I get older, but the key is we are moving in the right direction. And I think there continues to be opportunities to make sure that we continue to elevate these issues, and that these trainings or these pledges or commitments, that a lot of folks are doing this across a lot of industries, are not just performative, but really have some substance behind them. So, we will continue the fight. Finally, but certainly noteworthy, is Serenity Women's Health and Med Spa. You opened that, as you mentioned at the very beginning, in the middle of the pandemic. What sparked you to open this practice at this time? And share with us the challenges. I'm sure there were some, but also the rewards that you've had in opening this new practice.
Yeah, so it's definitely something that I've always wanted to do. I wanted to create that safe space for women to be able to come and, get that compassionate care that we all deserve. And also to have in that same setting, a med spa where you can, indulge in self-care, get a facial, get a pap smear, get your mammogram order, all in the same space, right? And so a lot of women, don't like going to the gynecologist, and They don't like going in for their annuals or their pap smears. It can be somewhat, of an invasive exam. Well, it is an invasive exam. And, so this was something that I thought would help to bring more, and I thought about this in residency, actually medical school, that this would bring more people into the doctor if it's not really set up just like your typical clinic, that it was very relaxing. Like we have aromatherapy in the office, and it doesn't look like your typical office when you come in. And the fact that you can come in there and get all these other services or massages and things like that, just to kind of incentivize getting your wellness, prioritizing your wellness and your self-care as well, which is important. So that's why we wanted to do it, my partner and I. And the reason why it happened during the pandemic was because, that was our goal, to open it that year, regardless of the pandemic. The pandemic happening really made it more, it really highlighted more of a need for this. And so patients were really looking for physicians of color. And my partner and I were both that. They were looking for a place where they could get, all of those different services in one place. Plus, in Pearland, there really wasn't enough, even though it's a diverse community, there wasn't enough practices that was able to provide what we were trying to provide. So for all those different reasons, we wanted to open regardless of the pandemic. And we were in somewhat of a recession-proof field. I mean, people are still having babies. And, we were like, let's take this leap of faith. We're going to open it anyway during the pandemic. And we really still felt there was a need. I mean, the need didn't go away. So that's why we decided to do it. Now, as far as challenges, it was extremely challenging. When it comes to banks, when it comes to loans, when it comes to things from that nature, nobody wants to fund a startup private practice from two young physicians in the middle of a pandemic, when other offices were closing their business, they were closing their doors. So it was difficult to find somebody that truly believed in our business plan, our model, and somebody who really, trusted us. But we were able to find that and secure a place. And we navigated past those obstacles together, and we were able to open within 6 months.
Well, congratulations on that. I've always thought about the fact that place matters and the physical plant matters, right? And so it's not that you have to have a lot of bells and whistles, but I believe that the space that we care for our patients in should be respectful of our patients, right? Mm-hmm. And you should be able to go to a respectful place, no matter your income. No matter your insurance status. So congratulations on that, and the perseverance that I'm sure that it took to get through. What comments have you received from your patients about the place and the fact that you are incorporating self-care and it's a serene setting? Of course, as a psychiatrist, I don't have to have all of the things that you do as an OB-GYN. But clearly, I do, again, appreciate the serene setting, but certainly it's easier for me as a psychiatrist. So what have you heard from your patients across all of the perhaps income spectrums that we've chatted about today?
Our feedback has been wonderful. Like, our patients love it. They have left great reviews on our websites, on our, social media. They've given us, verbal, feedback. They love it. They love coming to the office. And that was the whole point, was we want you to come, we want you to feel empowered. If you have a question, you shouldn't be embarrassed. You shouldn't feel ashamed if you are having infertility issues, if you're having, some type of vaginal issues, that you should be able to feel comfortable to come to the doctor and to have a doctor that's going to assess the issue and to treat it. And so our patients love it. And they love the fact that, because it's literally two separate hallways. So, you come in, it's the same waiting room, but one hallway is the clinic, one hallway is the med spa. So while patients are waiting for their appointment, sometimes they're like, okay, well, after this, I'm going to sign up for a facial and a massage and get a hot stone. And, and so we really love that aspect. And I had a patient tell me this one time recently, and she said to me, she said, a lot of times we feel like we don't, and this was specifically a Black woman. And she said she feels like we always feel the need to keep going, to work hard, because that's how we're taught. And although, hard work is important, that sometimes we forget that we have to treat ourselves, and that we deserve luxury too, and that we deserve to have, all the same, aesthetic treatments and the same, luxurious services that anybody else is able to get. And so that kind of speaks to what you were saying, as far as regardless of your income and things like that, that you still can, go get a facial and things like that. That's not just something that only rich people can enjoy. That's not something that only white women can enjoy. That, all of us deserve it, and all of us need it, especially, which I'm sure you can relate, like from a mental health aspect, like we all need it, especially during this pandemic.
Well, Dr. Cross, I can say it's been an honor to speak with you again. Thank you for everything that you've done to promote women's health in communities of color. Before we log off, is there anything you'd like to say about your hopes for your work, this new practice, this new venture, or medicine in general going forward? What do we all need to do? And I say all purposefully, to make health and healthcare more equitable and accessible for all?
Yeah. So like, as far as like future works and plans to move in that direction, so I recently actually started a nonprofit called What a Doctor Looks Like. And what I really plan to do with that is really starting a lot of different mentorship programs, scholarships, and things of that nature, to be able to get more minorities, and pulling our youth from different inner city areas and underserved communities to be able to get to the medical fields and the STEM fields, because I do think more of that is needed. And there's different programs that are out there, but sometimes, they have a 5-day program, 10-day program. And really, when it comes to mentorship, when it comes to things like that, it's not 5 days, it's not 10 days, it's a lifelong experience. And so really being able to foster those relationships and to carry, our youth from first grade all the way into, matriculating into medical school and further, I think is really, really important. And so that's something that I'm really focusing a lot of time and attention to. And so I definitely would encourage everyone to get involved with different local nonprofits or different programs that are doing that, because at the end of the day, that's what we all deserve, that equitable healthcare. And the only way we're going to see change is if we're all working together to be able to provide that for the entire community.
Well, thank you, Dr. Cross. As you know, I live here in Atlanta, but I tell you, you're tempting me to move to Houston just so I could experience the care that you and your partners give. And it's certainly music to my ears to talk about the need to mentor and start young. As a child psychiatrist, I think a lot about socio-emotional development and skill building early on, no matter what you want to be. Of course, you and I have the privilege of being physicians, and we love what we do. But I always say I want every child to be able to live their healthiest life. Thank you so very much. An honor to be with you, and an honor to be able to feature you here at Everyday Health. I look forward to seeing what your work brings. It will certainly bring a lot of rewards to us all.
Thank you so much for having me again.